Over 1 million Americans are living with HIV. Over 40 million people worldwide have been affected with HIV. Last year, over 3 million people died from AIDS, which is like the entire population of Chicago dying yearly. This video, we will answer the questions: what is HIV? How do you get HIV? And how do you treat HIV?
Hi Miss, how are you?
Not feeling well.
Nice to meet you.
Have bad news.
Okay, can we talk about it?
Yes.
Okay, you want
That's
to sit
why
down
I
with
came.
me? You want to sit down with me?
I have a problem.
Okay.
I have a problem and I need answers to my problem.
Okay. That's what we are here for. You want to sit down?
Am I going to die?
Can we talk about it? What's your name?
My name is Jane Doe.
Alright, my name is Florence. That's Florence. And I'm here to help you. Once you work in here, you'll be able to get the help you need. And is it okay if I call you Miss Jane Doe or Miss Doe?
Jane is fine. You can call me Jane.
Jane, okay. Nice to meet you, Jane. Okay. So what is the problem?
I was not feeling well last week and I went to see my doctor and I was told I have HIV. And they wanted me to follow up with you.
Okay.
What is HIV? I didn't do anything. What is it?
Okay. When did you get tested?
Just last week.
Okay.
I was not having any symptoms. I was just having fever. And I went there and they checked my temperature and they did some lab work too.
Okay.
And after that they came to tell me that I was having HIV.
Okay.
How am I going to tell my husband about HIV?
Okay. Maybe at the end of the conversation you'll be able to find out
HIV.
what is HIV and what
The
is
disease
HIV.
that kills everybody. Am I going to die?
Can we talk about it now? Okay. We're talking about HIV. HIV, the meaning of HIV is human immunodeficiency virus. These are some viruses that attack your immune system, and what we mean by that is everybody has antibodies like soldiers fighting to protect you from infection in your system. So when this virus get into your system, they attack the immune system, or the soldiers protecting you from infection. So they'll be inactive to fight against any infection that comes in your way. But we have the actual cause of the HIV is unknown, but we have other predisposing factors, things that will make you get the infection. This include unprotected sex, and then multiple partners, people with so many partners jumping from one woman or one man to
I only
another.
have one partner, just my husband.
Okay. Since we don't know how you got it, maybe by explaining everything,
You're going to tell me the causes, what caused
I'm going
it?
to tell you everything. You just have to stay calm and listen to me.
It's
And
hard,
after that,
man.
I know. But after that, if you have a question, we'll be able to resolve
I
it,
don't even
okay?
have insurance.
Okay, we'll talk about it and you'll be able to get the help that you need. We're talking about sharing needles and syringes. Also, in the drug users, those IV drug users, when they share the same needles and syringes, and then they are able to transfer the disease from one person to the other. And also needle and sharp stick in the hospital, like in the healthcare workers. Where do you work?
I work in a nursing home. I got laid off about a month ago.
What job do you do?
I'm a housekeeper.
Okay, all right. So we have people in like housekeeping. They can get needle punches or needle sharp stick, and that can also transfer the disease to another person. If that person that got it, HIV, they can transfer it to any other person. And also we have transfer from mothers to babies during pregnancy or at birth. That can also be transferred to the baby. And also we have body fluid like blood, when you get blood transfusion in a hospital when you are sick. If the blood is infected, you can also get the disease. And also contact with body fluid like semen, like I said, through sex, and also like fluid from the mouth, any other body fluid. If you have an open wound and that fluid contains the virus, that will be able to transfer to you too. And also we have HIV positive. When somebody has HIV positive, then that means they are exposed to the disease. It doesn't mean you have the actual AIDS. The actual AIDS is the disease.
Really?
Yeah, but when you have the HIV positive, you've been exposed to it. So we need to find means to protect you so it will not turn into the actual AIDS disease. So at this point, you'll be able to get some treatment to subdue or to break down the virus so your immune system can build up to be able to fight against disease so you don't get the actual AIDS.
So you're saying the HIV is you just been exposed, but you don't have the actual AIDS?
That's right.
Okay.
So at this point, you have the HIV positive. You've been exposed to it. So we just have to protect you so you don't get the AIDS, which is the actual disease. That's what we try to protect you from. So if you're able to follow your treatment regimen, taking your medication and follow up with any instruction that we give you, you just protect yourself against the virus developing into a full-blown HIV, which is not what we're expecting you to have. We just want to help you to be able to protect yourself against the virus, turn it into AIDS. And also when you have the AIDS, that's the actual disease at that point. It's what you are thinking, that's the actual disease, which we don't want to go there.
Yeah, I don't want to have it.
We want to protect you from that. And at this point, we want you to come to the hospital every 3 months at least, every 3 months, to be able to get tested, to see the progress or the response of the treatment. And this will help you to be able to know if the medication is helping you or the dosage is low. We need to assess all those by doing the blood work, so we'll know whether to change the medication or to give you a new one, or to decrease or increase the dosage. So the doctor will assess you to find out about that. At this point, do you have any question?
I think I'm feeling a little bit better.
Okay.
You're saying if I take my medications, I'm not going to get the AIDS. I'll be able to live a normal life.
That's right. That's right. And if you follow the instruction and protect yourself. So we have the medication.
But my problem is I don't want my husband to know.
Well, at this point, you need to let your husband know because he also needs to be tested.
I don't want anybody to know. You're not going to let anybody know about this, right?
We don't do that, but we want you to get your husband tested. So we'll be able to know if he's positive or negative, then we'll know where to go. Because we need to protect him too. If he's positive, then we have to educate the two of you so you don't advance into the AIDS. And if he's negative, then we need to protect him too. So at this point, your husband needs to know. So we want you to let your husband know.
Yes, I need to bring him here and you help me tell him because I don't know how I'm going to tell him this news.
You can't keep it to yourself. You still need to let him know. So we'll be able to help the two of you together to be supportive to each other.
Okay.
Alright. So at this point, you want to talk to the medication nurse. She will walk you through the medication and how to take it and what it does. And that will be able to help you to be able to do whatever you need to do. Okay?
Okay.
I'm going to talk with you about the medication that you need for your HIV diagnosis. You want to have a seat again? I know this is a very frightening time for you, but by taking your medication daily, you will be able to live a pretty normal lifestyle. Okay?
Okay.
Now I'm going to talk to you about the medication that you need to take. It's called an antiretroviral drug, and that just means that the drug, it doesn't allow for the virus to continue to reproduce in your body. It doesn't cure your HIV, and as I just stated, that it only stops the virus from reproducing more in your body. You need to take the medication daily, and you need to come to the clinic and get your blood tested maybe every 3 months. So that will give the clinic a chance to see whether or not the medication that you're taking is responding to treatment.
The problem is I don't have money to get this medication.
That's okay, because you can get the medication free from the health department.
Can I get a supply today? Because I want to take these medications and feel better. I don't want to get the AIDS.
Yes, we will give you a supply. Usually you can get like a month supply, and then you return to the clinic and you get your refill, and then you return again. And then by then, that will be around the time that you need to get your blood rechecked.
Thank you. I think I'm feeling better now.